Well, good morning, everyone, and welcome to Bishop Carroll High School. I'm Cheryl McInnes, and the principal of this incredible school. We are privileged to welcome back Premier Danielle Smith, and I say welcome back because Bishop Carroll is Premier's alma mater. It may have been a while since she walked these hallways, and like all former students, she will always be considered part of our community. We also have Minister of Mental Health and Addictions, Dan Williams, and Minister of Education, Demetrius Nicolaitis. They're joining us from the Alberta government today. So please join me in welcoming Danielle Smith, Premier.
Well, thank you. Thank you, everyone. You all know my official first name, too. I'll make it easy for you to find my picture on the wall in 1988. There was a lot of hairspray back then, right? So good morning to everyone, and thank you to Principal McInnes for the kind introduction. I'm joined today by Dan Williams, Minister of Mental Health and Addiction, Demetrios Nicolaitis, who is our Minister of Education, Shannon Cook, Chair of the Calgary Catholic School District, Bonnie Blakely, Chief Executive Officer of Cassa Mental Health, and Crystal Gray, Board Member of Cassa Mental Health. It is great to be back at my old high school, Bishop Carroll. It certainly does bring back memories. I saw one of my old classmates as well, who is now a teacher here, Madam Fior. Nice to see you. And it also reminds me of the pressures everyone faces while growing up. Those pressures are even more intense in this social media era. And combined, all of these pressures take a toll on kids' mental health and well-being. We want to ensure that every child and youth has the mental health supports that they need to get through high school and through all the societal pressures, and emerges confident and well-adjusted young adults. And to do that, we're increasing access to mental health services for children and youth. To do that, we need to have strong partners, and fortunately, we do have those. In Alberta, we lean on Cassa Mental Health as one of the most important partners to deliver these services. With support from Alberta's government, Cassa delivers critical mental health services to help youth and their families pursue a path of recovery. And it is a path of recovery. In the conversation on mental health and addiction, we are most used to hearing the word recovery when we speak of addiction, but Albertans who are trying to improve their mental health are also on a path to recovery. And this is true whether they are adults or children or youth. To help along this path, Cassa offers a full range of programs from community-based care to intensive treatment designed for young people experiencing mental health challenges. And they've been doing this for more than 30 years. They built an amazing track record, becoming the province's second largest provider of mental health services for children and youth. Last year, we ran on a platform to increase mental health services, which is exactly what we're announcing today. And I'm pleased to announce that over the next 2 years, our government is providing Cassa Mental Health with a record-breaking $148 million to help them expand their operations across the province. This includes fulfilling our election promise and mandate to triple the number of mental health classrooms from 20 to 60. These classrooms, and I understand there'll be one right here, are an innovative way to support students with ongoing education while receiving professional mental health care. It also includes funding to support the building and operation of 3 new residential mental health facilities for youth known as Cassa Houses. These new Cassa Houses will be built in Calgary, Fort McMurray, and Southern Alberta. One Cassa has all of these services up and running. Once Cassa has all of these services up and running, about 2,000 more Albertans will get the support they need every year, and they'll be able to find support closer to home. This is all part of the Alberta recovery model, our approach to treatment for mental health challenges and for those suffering from addiction. It's centered on helping Albertans of all ages find appropriate care to support their recovery. Children and youth who are struggling deserve to get the help that they need. We'll ensure many more of them are able to find it through this investment. And with that, I will ask Minister Dan Williams to share more.
Well, thank you, Premier, and thank you to all of you for being here. It is incredibly exciting to be here, Bishop Carroll with the Calgary Catholic School Division and our partners at Cassa. It's a terrific investment, as the Premier just announced. And it's wonderful for us to be providing services for our students, for Albertans, across the entire province for those who have complex mental health needs in our school systems, in our communities, and our families, to know that they're going to get the care and support they deserve as a part of Alberta's recovery model. Now, Cassa is Alberta's second largest provider of mental health services. They deliver a variety of supports to children, youth, and to the families to aid in their pursuit of recovery suffering with a mental health challenge. This means being able to live a fulfilled life, even when symptoms and challenges exist. Every Albertan, even and especially our children, deserve an opportunity at recovery. And the truth is, anyone can face mental health illness. And over the past decade, and especially since the pandemic, we've seen increasingly a larger and larger impact on our youth and children when it comes to mental health. And our response is to expand services in your communities and with your families at record levels of partnership with organizations like Cassa, the absolute best in the country. We're doubling, as the Premier announced, the funding that we're bringing to Cassa with $148 million over the next 2 years, $40 million of which will go directly into Cassa mental health classrooms like the one we're going to see here at Bishop Carroll, tripling the number of classrooms funded across the province to 60 by 2026 in September. We're pleased to move forward with this initiative. It was a campaign commitment that we focused on in our communities across the province, and it was also included in my mandate letter from the Premier. I want to briefly share with you what a classic classroom is and how it differs from a standard classroom. And as well, we're going to have Bonnie and Crystal from Cassa, who will also be speaking after me to provide even more details in terms of what this can look like in terms of the services that they provide. A Cassa mental health classroom is made up of students who face complex mental health challenges, and this could be from across an entire district or division coming to one classroom. And it aligns full-time access to mental health therapists, to mental health aides, to professionals such as MDs and psychiatrists and nurses to support the recovery of a very high ratio of specialists and support to those children who need and deserve that opportunity at recovery. I had the opportunity just yesterday to visit with Cassa at a classroom in Edmonton that was already up and running at St. Gabriel's, and I saw firsthand the benefits to these children and by consequence the families in terms of what can be provided through this very focused support, and also the support that it gives to the teachers across our entire division and across the whole province who want to focus on being teachers. And when the burden becomes so difficult with healthcare and mental health being provided, Cassa classrooms provide a reprieve for them to have that absolute highest level of care that those children deserve, which benefits every classroom and every student across the province. Currently, 8 of these classrooms operate in Alberta and 12 more to be scheduled online in early 25. Thanks to the additional funding by the Premier and this government, 60 mental health classrooms will be operational by September 2026, supporting more than 140 communities across the province. And all told, this $148 million, the doubling of support, is going to support over 2,000 students per year when it comes to severe and intense mental health supports in our schools and in our communities. It also includes today $98 million for the building and operating of 3 more live-in mental health residential facilities known as Cassa houses, similar to the one we have in Sherwood Park. Currently, one Cassa house operates in Sherwood Park, 19-bed facility for kids from grades 7 to 12 to live and receive treatment for complex mental health challenges. At these Cassa houses, on-site schooling takes place alongside robust mental health care through individual, group, and family therapy, as well as social and life skill training. With new Cassa houses being built in Fort McMurray, in Calgary, and one in southern Alberta yet to be decided the exact location, we anticipate them to be operational in spring of 27. Additionally, other services delivered by Cassa will be expanding too, including into Calgary, for which we are allocating province-wide $10 million over the next 2 years. As a government, we are committed to providing children and youth with the opportunity at recovery. It is essential that these young children facing complex mental health challenges, along with their families, can stay connected in their community, to their family, to their social group, in their schools, and their social circles. Cassa and our school divisions are instrumental in achieving this end, and I commend them for the work that they are doing together between the divisions and Cassa to help build a supportive community for our youth. I look forward to the coming months and years with these new services taking shape and coming into communities across the entire province and not just Calgary. Because we understand as a government that as the needs increase for mental health supports, we need to be there to provide them for Albertans so that every one of you can get access to the support and care that you deserve. Coming from Northern Alberta, from a community that's approximately 11 hours north of Calgary, I understand how important it is to have access to these services no matter where you are. And so we're going to continue to expand these services so that every single family and community can have the support and care they deserve. And these 2,000 spaces that we're going to be opening up per annum is just the start of the work that we're doing in the Premier's lead when it comes to building the Alberta model of recovering. Once again, I want to thank each of you for being here. I want to thank the students at Bishop Carroll for greeting me so charitably this morning when I arrived. And I want to thank Cassa and the school division for their collaboration in a tremendous example across the province of what you can achieve when you work together. And with that, I want to invite Minister Nicolaides to share his comments as well.
Well, thank you so much. Good morning, everyone. Premier, thank you so much for this incredible announcement and investment that will certainly work to strengthen and improve mental health services and resources for our youth. Thank you as well, Minister Williams, for your support and your advocacy for mental health and addiction services and treatments and recovery initiatives throughout the province. Thank you as well to Calgary Catholic School District Chair, Shannon Cook. Thank you to the amazing trustees as well who are here today for your work broadly in Calgary Catholic School Division and for the amazing work that you do serving students in your district. Thank you as well to Principal McInnes for allowing us to be here today. And I can tell already in just the short interactions that I've had with some of these amazing students that I had an opportunity to talk with earlier today and the staff here that everyone here is really focused on making sure that the students here continue to receive a world-class education. I want to pause there just to recognize and thank all of the amazing individuals that work here, our teachers, other staff, educational assistants, and other members of the community and other staff members for all of the amazing work that you do every single day to deliver a world-class education for our kids. I'm really happy to be part of this incredible and important milestone celebrating our government's investment in expanded mental health supports for some of our province's most vulnerable youth. As Alberta's Education Minister, I just want to take a few moments to talk about mental health and academic success. Together with Cassa, mental health, and our school authorities, we are working and helping students better access their education. I recognize that when it comes to our future, nothing is more important than investing in the well-being and education of our kids. Supporting positive mental health is vital to our students' success. It allows them to be more resilient. It allows them to be better able to learn, achieve success, and form healthy relationships. Which makes Cassa's Mental Health Classrooms an exciting program that will help students facing mental health challenges in the classroom get the help that they need and deserve. Within these classrooms, students will have a team of mental health professionals and staff beside them to provide them with the care they need. This could include individual therapy, psychiatric care, or other forms of service. These classrooms, including, as we've learned, one right here at Bishop Carroll High School, will help students who need mental health supports along the way. Again, I'd like to thank the Premier and my colleague, Minister Williams, for championing this cause. And I also want to thank Cassa Mental Health for their commitment to this initiative. I want every student as well to know that if you are ever struggling with your mental health, do not be afraid to speak up. We are here for you, and we will provide you with the help that you need. Programs like Cassa Classrooms will help you through the hard times and help you flourish, both inside and outside the classroom. I look forward to seeing more of these classrooms coming to life across the province in the coming months and years. Thank you again.
Thank you, Minister. Good morning, everyone, and happy Friday. My name is Crystal Gray, and I'm joining you today as a Cassa Mental Health Board member, as a partner in advocacy for mental health, but also as a mother with lived family experience in mental illness. If this is your first time hearing about Cassa Mental Health, I'd like to take a moment to introduce you to the amazing work that we do. Cassa Mental Health is an accredited nonprofit organization delivering holistic, culturally safe, wraparound mental health services to Albertans aged 3 to 18 and their families. Cassa aims to build resilience through evidence-informed and compassionate care, and to advocate for children, youth, and their families with mental illness. What's most profound is we've been doing this for nearly 40 years, and we continue on into the future. Prior to 1988, Albertan families with children facing mental health issues had limited options. A small group of parents, together with a team of psychiatrists, joined forces to provide children with high-quality care in a community setting. This is where Cassa was born. And we quickly expanded to meet the mental health needs of children and their families from Edmonton and central as well as northern Alberta. Today, that legacy of expansion continues as Cassa has its sights set on reaching every corner of the province, including Calgary as well as southern Alberta. In 2021, Cassa revamped its vision, mission, and values while working on a 5-year roadmap that focused on advancing the future of mental health services for children, youth, and their families. The North Star of this plan was to deliver more services to more children all across our province. This is brought to life through our new vision, a community where all children, youth, and their families are provided with timely mental health care and empowered to thrive. That's why we are all here today. The expansion work in collaboration with the Government of Alberta is truly symbolic of that vision. By the time these services are operational across the province, Cassa will be able to serve approximately 2,000 more Albertan children, youth, and their families per year in hundreds of communities. This is in addition to the thousands that we already serve in the Edmonton and surrounding areas. As I mentioned, I'm a Cassa board member, but I'm also a parent with lived experience. And as a parent, I know what it feels like to stand helplessly by, watch your child suffer with mental illness, spending sleepless nights doubting yourself, and navigating a system that you feel is not easy, nor set up to provide them with the care that they need. My youngest son suffered from a debilitating anxiety disorder and PTSD, brought on by trauma associated with an incident of stalking in his grade 6 year at school. It culminated with a death threat by a classmate. After navigating the justice system, I was left with a child who went from thriving to experiencing negative physical symptoms, altered and antisocial behavior, emotional dysregulation, and an avoidance for life and activities he once adored, with no support or guidance on what to do next. The fights, the tears, the outbursts, the breakdowns, and the heartache that we've experienced is not something I would wish on any family. Finding help and support wasn't readily available or inexpensive, but my job as a mom was to help my child. Thus, I kept pushing forward. We were lucky we found care, and my son is a completely different child today because of the support he received. He plays competitive sports, he does extremely well in school, and the emotional dysregulation has massively decreased. He's even developing solid relationships with his peers. So my story is merely one of thousands out there, which is why it is so paramount that we build community-wide systems and supports for mental health, especially for our children. That's why I joined the Cassa board, because I feel we all have an obligation to make the world a better place. And this starts by expanding a system of care that provides mental health services to children, youth, and their families, meeting them where they are. Albertan families need programs like Cassa Classrooms, the Trauma Program, Cassa House, the Adolescent Day Program, and we are so excited that we are able to share them across the province now. This expansion is part of a transformational change that focuses on re-envisioning the delivery of children's mental health services in Alberta in order to address the higher acuity and number of children and family in need. I'd like to thank our partners at the Government of Alberta, Ministry of Mental Health and Addiction, for walking alongside us as Cassa Mental Health continues to empower Albertan children, youth, and families to thrive. In the words of author Erin Gruwell, if you can change a classroom, you can change a community. And if you can change enough communities, you can change the world. With government support for organizations such as Cassa, I believe that we can change the world for better, starting with mental health services that are available in classrooms and communities across our province. I'd like to welcome Bonnie Blakely, CEO of Cassa Mental Health.
Thanks, Crystal. So first of all, I just want to thank everyone for having us join you. I think being in Calgary is a new thing for me, so I realize I might have to get a Calgary Flames jersey instead of an Edmonton Oilers one now. I want to also thank our students who welcomed us. I agree with the Minister. What an amazing welcome, and gives me pride in the future of our province with young people like yourselves. I am Bonnie Blakely, and I'm the Chief Executive Officer for Cassa Mental Health. And when mental health impacts of the pandemic began showing up in our communities, in our homes, in our workplaces, and in Cassa's therapy rooms, we recognized that we needed to do something different. This change focused on re-envisioning what the delivery of mental health services in Alberta could look like. We needed to address the higher level of needs, the number of kids and families that we were seeing, and look at a commitment to being part of a continuum of care for kids and families. We call this work filling the missing middle. I too, like Crystal, am a mother of lived experience who've navigated the mental health system. And as a result, I actually like to describe Cassa in this way, in a way that I think many of us who are not in the health system every day would understand. The truth is, when it comes to mental health services, it isn't a system. It tends to be a bunch of disjointed services where we often fail to transition kids back to their communities and providers and homes effectively. This experience is not just Albertans. We hear it from families across Canada and beyond. As a parent of lived experience, we try our best to find our kids the services they need. We work with community and family doctors. Then when that illness becomes too complex, we typically bang our heads for a time, and then eventually, with high probability, we end up in an emerge department. And then when we're not severe enough to be admitted, we do it all over again. Cassa Mental Health has been providing that missing middle for more than 40 years in the Edmonton and Northern Alberta areas. And since 2021, with the help of our board and our government, we've been partnering across the province to try to build a system of care. Cassa's role in that system is very clear. We are not providing prevention, promotion, or primary care services. We have amazing partners in your communities doing that, and we work alongside them. And we do not provide emergency response or hospital services. We work with our colleagues who do that every day. We're filling what is that missing middle. We work with kids who have complex challenges and mental health, where they're too complex to be cared for in their community, and we don't want them ever to wind up in a hospital. Kids and families deserve better, and Cassa's here to be part of that solution. It is about thinking and acting like a system. That said, I have to say, after 30 years and 2 children who suffer from mental illness, I'm excited. There's something pretty special happening in this province. And I want to thank the Government of Alberta and the Ministry of Mental Health and Addictions and Education for thinking differently. By 2028, we're going to have more services closer to more kids and intervening in a more timely way than ever before in Alberta. What's that going to mean for Calgarians? By 2027, we're going to be able to provide more services and trauma supports for kids who have complex mental health challenges. When our classrooms are up and running, more than 1,350 kids across this province every year will get more timely interventions. And as we think about our Cassa House program, which is a stay program for kids and families, we'll increase the number of kids by more than 300 a year to provide that service. You've heard people say that 2,000 children, youth, and family will be served, but I'm here to tell you behind every one of those numbers is a family whose lives are going to be changed. I recently was talking to a parent whose child is in one of our classroom programs, and he told me this story. He said his daughter had not gone to school for 2 years. Her anxiety and depression was so high. They worked with Cassa, and on the first day that he drove her to the school, she got out of the car and went into the classroom. You think the story would end there, but his story was more than that. He said he sat in his car for almost an hour crying. And when I asked him why, he said because their daughter could not go to school, his wife had had to quit work for 2 years. Sometimes we forget that the impact of a child's mental health not only impacts a family, but their ability to have the resources they need to actually be able to care for that family. And he said, my wife can finally go back to work so our family can be financially stable. We're so excited that behind every one of those numbers, we know we're impacting a family. We're a nonprofit charitable organization at Cassa, and government's committed to giving us money to build some amazing facilities, but we know we're going to need your help because our commitment is to match that money. So to ensure those facilities get built, we're going to depend on the support of Albertans across Alberta. So I'm going to encourage you right now to go hear more about us at cassamentalhealth.org. You can learn about our services, how to volunteer, or you can start donating if you like. We'd like to thank the Government of Alberta, Ministry of Mental Health and Addiction, the Ministry of Education, and all of our community partners for embodying our vision of all children, youth, and families having timely access to mental health services and being empowered to thrive. Thank you.
Good morning, everyone. I'm so glad to see all of you. Welcome to Bishop Carroll. Welcome to Calgary Catholic. I'm Shannon Cook, Board Chair of the Calgary Catholic School District and Trustee for Wards 9, 10, Chestermere, and Online Learning. On behalf of the Calgary Catholic School District and our Board of Trustees, it is my pleasure to be here to celebrate the inception of this valuable partnership. I'd like to take the opportunity to welcome our special guest, Premier Danielle Smith, MLA Dan Williams, I'm going to get this, I swear, Dimitrios Nicolaides, and the people from Cassa. I'd also like to recognize my fellow trustees that are in the audience here. So Myra D'Souza for Wards 1, 2, 4 in Cochrane, Mary Martin for Wards 13 and 14 and 4, and Linda Wellman, Wards 3, 4, 5, 7 in Airdrie. Calgary Catholic has become one of the most successful school districts in the province by diligently working to provide the highest quality programs that educate and empower students from kindergarten to grade 12 through our mission of living and learning in our Catholic faith so that students centered in Christ realize their full potential. I'm also super pleased that we're talking about mental health today because I think it's something we don't talk about a lot. And it's certainly something that our students, that we are trying to support our students with. So this announcement will certainly make a big difference with that. Calgary Catholic's reality is that the number of students with complex needs in our district continues to rise significantly. This school year, nearly 1 in 6 students have a learner support plan, a plan which is developed to address the learning and often complex needs of students. Those complex needs may include autism, significant dysregulation, cognitive disabilities, medical diagnoses, and mental health challenges, amongst others. And often students have more than one of these complex needs. The timing of today's announcement has special significance as this week is Mental Health Week in Canada. We are grateful to participate in this partnership between Cassa Mental Health, the Government of Alberta, as well as other school divisions and community partners, which will offer Cassa Classrooms. Cassa Classrooms are designed for students in grade 4 through 12 and embed mental health services directly into the school. Students who may benefit from Cassa Classrooms include those who have not seen success with other therapy and continue to experience symptoms that impact their home, social, and school life. These supports will be provided in schools by a team of mental health professionals, a specialized teacher, and support staff. Calgary Catholic recognizes the importance of mental health as wellness is one of our 4 board priorities. Wellness goes hand in hand with student success. In support of our board priority of wellness, last year the district refreshed our wellness framework, a trauma-informed mental health framework. By implementing this framework in our school communities, the goal is to create learning environments where students feel safe enough to learn and brave enough to try. Our Board of Trustees continues to advocate to the provincial government for sustainable and equitable funding that will allow us to continue to support our students and their diverse needs, including advocating for continued funding of the Mental Health in Schools pilot, which began in 2023. The funding of this initiative is slated to end in January 2025. Experience from this pilot project and other measures we have provided to our students tells us that providing mental health support makes a tremendous and positive difference to our students and their families, as well as our staff and teachers. This investment from the provincial government will see a funding increase over the next 2 years to Cassa Mental Health to allow them to expand their child and youth mental health and addiction supports. As part of this commitment, 8 additional Cassa classrooms will open this September, 2 of which will be at Calgary Catholic schools. The addition of these classrooms will become part of the supports offered at Calgary Catholic and will complement the mental health supports that our district has already established. We are grateful that Bishop Carroll High School, this school, and St. Cyril's School will become the district's first locations to offer this program. The Premier was talking about her hair in high school and the hairspray that we needed to maintain our high school. On behalf of our district, I'd like to extend our sincere thanks to Premier Smith, her teams, and everyone else involved in this invaluable partnership. Calgary Catholic students need more mental health support and access, and we are very grateful for this opportunity to provide further wraparound support and services to our students while at school. Thank you.
And with that, we'll start the media Q&A portion of this announcement. We'll start off with questions here in the room, and we'll go with 1 question, 1 follow-up, and then make our way to the phones. We'll go to our first at the mic.
Yes, it's me. Edith Boisvert, Radio-Canada. So my first question is how this funding will help with mental health and specialist shortage, because from my understanding, you're creating a bunch of new positions, but we have no one to fill them up.
Right. So we're working with the school divisions and Cassa to make sure that as we go forward and between now and 2026, when we fill these positions, make sure that we have them in place. We've already had success up to now, just speaking with Cassa and the Calgary Catholic School Division about the work that they're doing to get that there. The shortage when it comes to mental health professionals is nationwide. It's not just Alberta. We have been working with advanced education and labor and immigration as well, multiculturalism and immigration, to make sure that we are bringing in more. We have a number of programs to that end. As a province, we know it's going to continue to be a challenge, but Albertans are capable of chewing gum and walking at the same time. We know we need to move forward. We're not going to let a shortage that exists internationally prohibit us from getting the care that we need to the students.
And my follow-up is going to be off topic. It's for Premier Smith. What do you have to say regarding the encampment and protests that are pro-Palestinian on University of Alberta and University of Calgary's ground?
Well, we've been watching what's been happening across the country, and it's already out of control in Ontario and Quebec and elsewhere. And the universities can't allow it to get out of control, and they can't allow hate speech. So there are reasonable ways to protest, and the University of Calgary in particular has said that trespass and camping is not acceptable on their grounds, and I understand that they removed the encampments yesterday.
And we'll go to our next at the mic.
Hey, Tim Brooks, CTV. Another off-topic question.
Sure.
You answered, or you gave an answer on this last week, but I just want to know specifically, did the Alberta Electric System Operator ask you for renewable pause to make sure that we could address grid stability issues?
I can tell you that we had lots of conversations with the board chair and the leadership. We had round tables with those in the electricity industry. And I looked at the amount of instability that we had in the grid. We've had 15 level 3 alerts in 3 years, and we've got to step in and solve that. My view is that if things were going perfectly and they were integrating renewables and solar and wind perfectly into the system, we wouldn't have that kind of variability. And so there may have been some concern about the impact it would have on the investment climate. I understand that too, but my concern is reliability, and so we had to make sure that we move forward on that.
Okay, so just a yes or no then. Did the operator approach you and ask for that pause?
We had a conversation with the board chair. Thank you. Yeah.
Okay, and then my next question is, just knowing now what we know about the original opposition, obviously, do you think the way that we went about this pause was appropriate?
Yes, I do. And because, look, I mean, I think that when we almost had a near power grid failure in January, people began to understand why I was so concerned about it. We had 12,250 megawatts of power being used, and we need dispatchable power. 5 o'clock at night, there was no solar. There was 7 megawatts of wind. And the only way you get dispatchable power is that you have to have natural gas or something that operates round the clock, like geothermal or small modular reactors. I can't just tell people, wait until the sun comes up at 9 a.m. to get your power back on. So I would say that you never want to have those kinds of incidents get to that level, but it did. That's how tight our system is. And that's the reason why we need to have baseload power coming on. Fortunately, we have 2,700 megawatts of new gas coming on, so it gives us a bit of breathing room to figure out how to bring on a responsible amount of solar and wind, but we absolutely needed to take a pause.
Thanks.
Thanks, Tim. And with that, we'll go over to the phones. Operator, can you put through our first caller, please?
Jonathan Bradley, Western Standard. Hello, Premier Smith. Thank you for taking my question. So, University of Alberta officials have said that, have indicated some support for the pro-Palestine encampment on campus, saying it is about freedom of expression. Do you intend on taking any action on this encampment? Why or why not?
Look, I've said that the universities have to take a lead on this. It's their private property. I think what they found in Calgary is that a large number of the people who were trespassing were not students. And I think that is, we have to be mindful of that. Kids are having graduation ceremonies. A lot of these kids didn't get a graduation ceremony for high school. It's not fair for them or their families to be disrupted. And so I'm glad that the University of Calgary made the decision that they did. There are appropriate ways to peacefully protest, but they have said no camping. And they also want to make sure that it's students who are on the campus as well. So I'll watch and see what the University of Alberta learns from what they observed in Calgary. But we're on standby to be able to provide any assistance should they ask.
Okay. And you mentioned yourself that there are encampments popping up, pro-Palestine encampments popping up in Ontario, Quebec, British Columbia, and now Alberta. What do you think is driving these people to set up encampments?
Well, I don't want to speculate, but I have seen some of the slogans that have been waved around, and there should be no room for anti-Semitism and no room for hate crimes. So I would say that if it accelerates and escalates out of control and devolves into hate speech, then I would say that the universities have to deal with that swiftly.
Thanks, Jonathan. Operator, can we put through the next caller, please?
Shailene Skolsky, CTV.
Hi, thank you so much for taking my question, and I apologize, it is off topic. It's for Minister Williams, actually. Yesterday at a pro-life rally, you spoke about how much you value the, quote, dignity of every single human life. I'm wondering if you can clarify your stance on abortion, whether you'd like to see your government restrict access to abortion services here in the province.
Yeah, thank you for the question. My position on life has been clear. I've attended the similar rally annually since being elected. I do it as a private member of the legislature and as a citizen of Canada. The Premier's been abundantly clear on this. The government has no policies being introduced to this end. That's really the end of the conversation.
And a follow-up?
My follow-up then is to the Premier. Yeah, to the Premier on that. Given several of your ministers and UCP MLAs attended that rally, and Alberta's own health minister used to serve on the board of a pro-life association, should Albertans have any concerns that changes to access abortion services could be changing under your government?
Well, I'm pro-choice, and I'm glad to lead a party that has a wide range of perspectives that includes people who disagree with me on this issue, because you can, I think, have a really robust, important discussion on a whole range of issues, and we focus on the things we agree on. So I certainly would, I don't ask my members to do anything that goes against their conscience, and I certainly support them in going to private events as private MLAs and private citizens.
Thanks, Shay. Operator, did we have any more callers on the line?
There are no other questions in the queue at this time.
Thank you. And we see one more here in the room.
Kevin from Global. Premier, you touched upon it. What was your thoughts on the use of force last night at the university, and was it justified?
I haven't seen very much on it. I think there's some videos that are circulating, but look, I don't direct law enforcement. The University of Calgary made it very clear they would not allow trespass and that camping wasn't allowed. And it was up to them to work with law enforcement to be able to clear, and I gather that they did.
And does last night's events differ in approach that was taken, say, at the Coots blockade?
Well, look, I mean, there are people who are going through a criminal process because of the Coots blockade. We have laws in the province saying you cannot block critical infrastructure. And in this case, it's private property. And the university made it very clear that you can't trespass and you can't camp. So I think people should follow the law. If you have an opportunity to do peaceful protest, follow the parameters, I guess, is the lesson on this and also on previous protests.
Thank you. And that's all the time we have for questions today. Thank you, everyone, for joining us.